All right. Well, good afternoon, everyone. It's really nice to see such a big crowd on our webinar today, especially because I know many of you are probably at home with kids during NTI. This weather hasn't been great, but I hope everybody's warm and safe. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health, and I am just delighted to see everyone today. Really glad that this time worked for us to do a legislative forum as we're getting ready to start the second half of the General Assembly. And for those of you who may be new to Kentucky Voices for Health and the work that we do, we're a coalition of consumer health advocates working to address the underlying causes of poor health through policy advocacy. And our mission is to lift up the voices of Kentuckians in the decisions that affect their health and well-being. So today's forum is one of the many ways in which we do that. With the 2023 General Assembly underway and with some very important new committees getting started, we wanted to make sure that advocates and other Kentuckians had the opportunity to hear from legislators and to interact with key legislators from both parties who will be taking the lead on policies related to health and family services. So we are just very, very excited to have such a fantastic panel of legislators today. And there is really no one better to moderate this discussion than KVH's very own Dr. Sheila Schuster, our board chair, and someone who has been a longtime advocate and a mentor and teacher to so many of us. So before I turn it over to Dr. Schuster to introduce our guests, I just want to do some quick housekeeping. We are recording today's forum, so you'll have the recording probably in your inboxes tomorrow, but be sure to mute your line so that we can hear everyone. We will be using the chat for any questions. Dr. Schuster will start with some questions that we have prepared for our guests today, but we do want to make sure that you also have opportunities to ask questions. So if you'll put those in the chat, we'll try to get to as many as we can during the next 90 minutes. And we will be sending out a few materials with the webinar recording tomorrow. You'll be getting an accessibility guide that kind of gives you all the details about how you can participate in the legislative session, how you can get in touch with your legislators, participate in committee meetings, and so on. That will be coming. It's something that we've done for the past few years and just updated, so it's hot off the presses. We'll also be sending out KVH's policy agenda, our policy priorities, as well as the Kentucky Coalition for Healthy Children's. And we are going to be sending you information about how to stay in touch with our newsletter and so on. So watch for that email tomorrow. And Kelly is going to be live tweeting today as we have this conversation. So we'd love for you to jump into that conversation. And we have a couple of hashtags we'd like for you to use. The first is KY Voters for Health, and we can throw that in the chat. And the second is KYGA23. So with that, I'm going to turn it over to you, Dr. Schuster, to introduce our legislators and to kick off the discussion.
Thank you so much, Emily, and thanks to all of you for joining us on this fairly frigid Tuesday in Kentucky. Let me quickly introduce our panel, and then we'll come back around with questions. And as Emily said, if you have some questions, put them in the chat, and we will try to get to them as well. So let me start off with Senator Danny Carroll. Senator Carroll has served the 2nd Senate District, that's Ballard, Carlisle, Livingston, Marshall, and McCracken counties since 2016. He has served on the Appropriations and Revenue, Education, Health and Welfare, and Judiciary committees. And we're particularly excited to have him today because he's the chair of the newly formed Families and Children Committee. So welcome, Senator Carroll. We also have with us Senator Stephen Meredith, who serves the 5th Senate District, that's Breckenridge, Butler, Grayson, Meade, and Ohio counties, and has done so since 2018. He has served on the Senate Health and Welfare Committee since joining the General Assembly, has also chaired the Medicaid Oversight and Advisory Committee, and now is the chair of the Senate Health Committee. It's now called the Senate Health Services Committee. So welcome to you, Senator Meredith. And hopefully joining us soon will be Senator Gerald Neal, who has served the 33rd Senate District, that's part of Jefferson County, since 1990. He has served on a wide variety of committees over those years of service, mostly on education, judiciary, and licensing and occupations. He was recently elected by his caucus as the minority floor leader in the Senate. So welcome to you, Senator Neal. Over on the House side, we're pleased to welcome the new chair of the new committee. That's Representative Samara Heavrin, serving the 18th House District, that's Grayson and part of Hardin counties, since 2020. She has served on the Licensing and Occupation, State Government, and Transportation Committees, and now is chair of that newly formed Families and Children Committee. We have also with us Representative Kim Moser, serving the 64th House District in Northern Kentucky. That's part of Kenton County and has been in the General Assembly since 2018. She has served on the House Health and Family Services Committee since joining the General Assembly and has chaired the committee now called the House Health Services Committee for several years. She also is a member of the Judiciary and the Licensing and Occupations Committees. Welcome, Representative Moser. And then we have Representative Lisa Willner joining us. She has served the 35th House District, that's part of Jefferson County, since 2019. She has served in the past on the A&R Committee, now serves on Education and Health and Welfare. And she has the distinction of serving now on both of the committees, both the Health Services and the Family and Children Committee. So welcome to you, Representative Willner. I'm going to start with that new committee, the newly formed Family and Children Committee. And I'll start with you, Senator Carroll, and ask you how you would describe the scope of work of this new committee, the Senate Families and Children Committee.
Okay, can you hear me okay?
Yes, thank you.
Yes. For me, it's, and I guess what I'm so excited about is in most all of the areas that this committee covers, I've had some experience with during my career. So that, for me, these are a lot of things that are very close to my heart, and it covers a very wide gamut in dealing with children. But, you know, over the years, we have seen that in health and welfare, there are so many topics that come through that committee that a lot of what we'll be covering in this new committee, there was not a lot of focus, not a lot of attention on these various aspects. So that's really what our plan is as we move forward with this, and probably going to use most of the session. I don't know that we'll really have a lot of legislation that comes through that'll be assigned to this committee. And on the Senate side, we're going to use it as an opportunity to educate the members on various topics that we're going to be looking at that fall under the purview of this committee. And you know, of course, Senator Meredith and I will be working together, and there's probably going to be some gray areas between the two committees that we'll need to work through also as we go. But, you know, a lot of things, the child welfare, child protective services, dealing with the children homes and commitments, child care, which is something Representative Heavrin and I have spent the interim working on with that task force, and dealing with a lot of the adults with the waiver programs, as you said, Sheila, and that's something that we really want to focus on also as we move forward. So covers a lot of area, pretty excited about it, but we have a lot of work to do and a lot of homework to do to prepare our committee members to be effective and to start moving some legislation in these areas.
Yeah, thank you very much. I think certainly we hear as much about childcare as we hear about almost anything else. It's one of the issues that keeps some of our Kentuckians from getting further education, from going back to work and so forth. And we talk in our roadshow that we did in 15 cities this past summer and fall about the childcare deserts. We have always talked about food deserts where food security, insecurity is a problem, but childcare really seems to be an area that we really need to be paying attention to. And certainly we worry about the welfare of kids that are in state custody or in children's homes and so forth, and particularly those kids that get sent out of state for treatment, which is another issue. I think it's where children and health services kind of intersect. So it'll be interesting to see in both the House and the Senate where you kind of carve out. I could picture some bills that really could really be the purview again of both committees, both family and children and health. So thank you very much for that. Let me shift over to the House side, and Representative Heavrin, ask you that same question. You know, you're new to this and new to the committee being formed, and I wonder how you are describing or thinking in your mind about what the scope of that work would be.
You know, I think many times you will not. First off, thank you all for having me. It's an honor to be on this panel with some of my great friends in the House and the Senate. You know, I agree. Generally, the House and the Senate don't always agree during session, right? But since we're not back in session yet, I'll go ahead and say I agree with Senator Carroll. You know, we're going to have a lot of tough conversations, but I think the most important part is going to be having an opportunity to learn and educate our members. So we'll be doing similar to the Senate of just educating our members. These are such big issues that really touch the everyday lives of people that are on these programs. And even the ones not on the programs with children and adults, especially our older adults with adult protective services. I want to make sure that our members actually know. A lot of times we like to assume things in Frankfort. And that's something Senator Carroll and I really worked on during the interim. It's just educating our people on what these things do and what it actually means, diving down a little deeper. And so I think you'll see on the House us having a lot of educational meetings to hear more about the scope that we're going to be covering, so we can educate ourselves. And then in the next session in 2024, we'll actually be able to make some movement. I think all of us are really trying to follow our leadership in hearing that this is going to be a slower session. And unless we as chairman decide that, you know, we've got to kind of set the tone for that too. So you won't see much legislation coming out of my committee this session, but you'll have a lot of education opportunities. And so I welcome all of you all to join us for those.
Thank you. That's an excellent approach, I think. So would there be opportunity, almost like we have during the interim, to come with educational topics to your committee during the session?
Yeah. There will be. There'll be an opportunity for that. You know, I think right now during the interim, it'll be health and family services will be combined again. So technically there will be 4 chairmen on that committee, is my understanding right now.
Oh.
And so I think this gives us an opportunity to spend a little more time really focusing on our issues. And then because during the interim, I think we'll be splitting up those meetings. So yeah, feel free. You know, I think I know I'm very open. I look forward to working closely with Chairwoman Moser on the House side, but also Senator Carroll too. Just, you know, kind of stay on the same page with things. We all work really well together. So continuing that relationship, but always feel free to come with us. I mean, the worst you're going to hear is no, right? We hear that all the time. So feel free to bring issues. And if it's something we feel like it's going to be helpful, then we'll say yes. But, you know, Frankfurt's not the place to have thin skin, so don't get your feelings hurt.
Good advice for our advocates that are listening in. Thank you so much. Senator Meredith, let me turn to you on the Senate Health Services Committee and ask if you think that the scope of your work perhaps has changed with this new committee structure.
I don't think it's going to change significantly. You know, if I was going to kind of capitalize it, I'd say that our charge is to improve the health of the population of citizens of Kentucky. And something that we've all talked about over the years is we need to have a concentrated effort to truly improve the health of Kentuckians. And that hasn't been there. You know, in spite of all the changes that have occurred over the last decade, we're still 44th, 45th in the nation in terms of health of population. And that's not a good place to be in. And I really applaud this decision that the House and Senate leadership has made to divide the functions of health services and children and family services. I think it's so important. I think in the past, what we have done is focus probably more on the health aspect, and you know, by virtue of the name, when we were health and welfare, you would expect that. But it's obvious with the issues we have with our children and our families that we need to pay more attention to what's happening on that side of the issues. And, you know, as you all well know, we're first in child abuse. So we have so many problems associated with that. And historically, there just hasn't been enough bandwidth available to us legislatively to address both the healthcare issues and the family and children's issues. So I think this is a great step in the right direction, and very optimistic of what will come out of it. But same theme as most of my colleagues have mentioned or will mention, that leadership has admonished us to try to get this back to the original intent of a 30-day session. So, you may not see as much movement as we have in the past, but kind of feel obligated to carry on the legacy of Senator Alvarado and file 1,000 bills and maybe here just 500. But jokingly, we certainly appreciate the work that Senator Alvarado has done, and that is legacy I hope we carry on. But again, if I'm going to summarize what I think our committee's responsibility is to improve the health of our population, and also do a better job of measuring the outcomes than we have in the past. And we talk about things we need to do, but we really don't see the fruits of those efforts, and we need to do a better job with that.
Yeah, and I think that's been a consistent theme from both you and Senator Alvarado. I wondered if you were going to try to match his record of bills introduced every session. So
no, I plan to exceed that. I like so.
We will look for those good ideas. And of course, I have to put in a plug as a psychologist that I know, and I know you know this, that when you talk about health, you're talking about physical, mental, dental, all kinds of health, a really comprehensive picture of the health of all of our Kentuckians.
Very wide spectrum, and each plays on each other. So you can't isolate one without having an impact on the other. So you're so correct.
Yeah, thank you. And I'll ask the same question of Chairwoman Moser in terms of how do you see your committee functioning with this kind of split off, or somebody called it a bifurcation of focus this session?
Well, hi Sheila, hi everyone. Thanks for having me today. And I've actually just a quick correction. I've been in the House since 16. I was elected. So
I'm sorry about that.
No worries. But I've chaired the Health and Family Services since 19, and now, of course, we have the bifurcation, as you say. It's an interesting idea. I think that it's a good idea. I'm going to agree with my colleagues, and I do think that it's important that we give DCBS and our family services more attention. Clearly, there are problems in our state that have not been corrected despite many conversations. And so I think that this is a real opportunity to pay more attention, give more attention to some real and some real direction policy-wise on these issues. I think that the scope of our committee is certainly large enough with health systems, measuring outcomes, as has been mentioned. I think we are getting better at that. We've put a lot of infrastructure and made some changes in recent years, and sometimes we don't give things enough time to work. So maybe it is time to kind of slow down, see what's working, really check those outcomes, take a deeper dive. Certainly we are concerned with our healthcare worker shortage. In our committee, we'll still have jurisdiction over physician, dentists, nurses, pharmacists, all healthcare workers. So we're still looking at all of those issues. There are always issues that hospitals bring to us, healthcare clinics, public health, long-term care. So I would expect to see some legislation, hopefully some fixes to some of the things that have passed in the past couple of years. This is a short session. We are really trying to get back to the original intent, which is to do a lot of cleanup and some tweaks. It's not to say that I don't have some big bills that I've worked on and I will file, and we'll just see where they go. I probably have a similar reputation to Ralph's in that we were simpatico in filing tons of legislation, but I think sometimes it's good to get those out to have conversations and really start vetting some policy decisions. So, I think it's a good thing. We will work well together. I look forward to working with Chairwoman Heavrin and Chairman Meredith and Chairman Carroll, and really, we have so much, I like to say, cross-pollination in healthcare, in all that we do, but certainly in these two committees.
Thank you, and we appreciate your prolific filing of bills, some of which have been, a number of which have been around mental health issues. So we thank you for that, and certainly the community health worker legislation last session, I think, is huge in the health field. So thank you, and welcome, Senator Neal. We're very happy to have you with us. And my first question to you is, what do you see as the top 2 or 3 priorities in this session in terms of Kentucky's health issues?
Well, I don't think there's much I can add to the discussion that's already been undertaken, quite frankly. We have very involved and engaged leadership in Senator Meredith and Senator Carroll on the Senate side. And I'm looking at the health side, and I see all these individuals are very much committed and involved as well. My perspective is that there are a lot of gaps in the system. There are certain parts of the system that are serving great parts of our population, but certainly a lot of people are falling off, are not getting the support they need, and we're deficient in some of these areas. So it's a multifaceted type of problem, and it's going to take a comprehensive dive and a perspective in terms of addressing these things. Just to give an example, there was a panel that dealt with the opportunities that we would have to fix the benefits cliff. If you are aware of that situation where we would try to we give certain benefits, but once you reach that criteria, and then all of a sudden you don't get none of those benefits, it doesn't take into consideration the transition and the challenges and the needs that people have in moving up that ladder, and it sort of forces them or puts them in a position where they don't take that next step in terms of doing things. So just things like that, I think we got to pay attention to and fix, or at least put policies in place that address that. But what I do like is I like this look, this reaching across, this coming together, coalescing around this issue, which has to be, by the way, revisited time and time again. It's not something you can just do and it's fixed. So I think this is a good initiative, and I'm very happy to be part of the discussion. And thank you for having me here. I appreciate it.
Yeah, we welcome that. And we're going to circle back around to the benefits cliff and the implications of the pandemic emergency period ending, which has implications for that as well. And Representative Willner, I'll ask you, since you have a foot in each committee, so to speak, what your top priorities are this session in terms of Kentucky's health issues.
Yeah, thank you for the question, and thank you, Sheila, for having me be part of this panel. It's good to see everybody. I'm always really focused on mental health. As a psychologist myself, that's an issue that's incredibly important. I want to thank you for highlighting that when we're talking about health, excuse me, that mental health has to be part of that conversation. Chairwoman Moser has been a great champion of mental health issues, and I've served on her committee ever since I was elected. There's been a lot of great work that's happened there. I think there's a lot of very strong bipartisan work that's gone on there. The community health workers, for example, the excused absences for student mental health. We could name a lot of really strong bipartisan efforts that have taken place in that committee. And I'm looking forward to working with Chairwoman Heavrin on the new committee. I was really very excited to be assigned to that new committee. I guess for me, in terms of my own priorities, in addition to mental health always, and particularly increasing access to mental health care, and specifically for kids, for students, mental health care in our schools, what that can look like. But I'm also really concerned about maternal health, and I'd like to see that as an issue that these committees really take up in a big way. You know, the United States generally has very poor statistics in terms of maternal health and pregnancy-related death, and pregnancy-related health issues, and Kentucky is close to the bottom of that list. So that's a very important issue that affects obviously pregnant people, but also families, also children, also the economy in huge ways. And so I would really like to see us take up that issue in a big way.
Thank you. And I know that there's been a lot of interest, and in fact, Representative Heavrin had a bill a couple of years ago that passed to look at the inequities, to at least begin gathering the data. Those of us who serve on the Medicaid Advisory Council, affectionately known as the MAC, have a regular update from the Department for Medicaid Services on what those statistics look like, and they're scary. We just had that presentation. In fact, and I don't know which committee, this is where which committee ought to be asking for this data, but you might ask Dr. Judy Terrio, who is the medical director at Medicaid, to come and give that presentation, whether that's in your health committee, Representative Moser or Senator Meredith, or whether it's in the Families and Children Committee, because she just did a report for the MAC last week. And it's scary to see the number of maternal deaths that we have, the number of cesarean sections that we have, and the disproportionate impact on our brown and Black moms. So I recommend that to you all as maybe something by way of education of your committee members. And again, whether, you know, who decides that falls in their committee scope, or again, would recommend that to you all on the maternal health issues.
Sheila, thank you for that. And you talk about disparate impact, and I also just want to add to that rural pregnant people. There are huge disparities there because of access to care issues and so forth. So it's another.
And I think that was another of the variables that Dr. Terrio looked at. So again, that might be something that you all, and that's been a theme, I think, Senator Meredith, from you, since you've been in the legislature as a rural healthcare provider when you were at Twin Lakes Hospital and so forth, have been very concerned about. Senator Carroll, let me circle back to you and ask if there are there one or two priority issues that you see particularly spending time on, whether they are specific pieces of legislation or, you know, a focus for your education and your committee this session?
Sheila, I think right now the urgency that I feel is to delve into the abuse and neglect issue within our state, and I think that has to be first and foremost in any efforts that we take. And you know, we've got to improve our rankings, and we've got to really determine what's going on in our state and where this is coming from, and the change that I hope to try to help facilitate as we look into these things is to really hear more from the frontline people, because if we're going to find the answers, I think that's where they are. The people that deal with families every day, that see firsthand the struggles that lead to abuse and neglect cases. And so really try to focus on that more in the future, and you know, get to a point to where these folks are comfortable speaking with us and sharing their experiences. And so I hope to be able, in one of the meetings soon, have a presentation on that, and then also continuing our child care efforts. And on the adult side, as you mentioned earlier with the waivers, you know, I've talked to Dr. Alvarado about this in Tennessee. They do not have a waiting list in Tennessee. They, if you're eligible for the services, you get the services, and I think that's something within our Commonwealth we've got to move towards. And I will likely have some legislation along those lines that will come this session. I have no expectation that it will move this session, but I just want to get that thought out and start working towards that end. And I know that's something that's important to Chairwoman Heavrin in her committee on the House side. Is that is an important issue in the state that I feel like we have to address. And I think we will see. There's a lot of concerns about there not being enough providers, but I think the providers will grow as the population grows with the waiver and with rates being adjusted. I think we'll see that these centers can sustain, and we will be able to serve more of our folks on the Medicaid waivers. And I do hope to make that a priority.
I am thrilled to hear you say that. As you know, our 874K Disabilities Coalition is very concerned about the waivers. For those of you listening, the waivers are waiving of the Medicaid requirements to focus on certain populations. And we have 6 of those waivers that are called the home and community-based waivers. So there are a number for people that are developmentally and intellectually disabled. And then we have 2 waivers for people with acquired brain injury and acute and long-term. And then 1 for people that are respirator dependent. I just had done the numbers on that, Senator Carroll, and we are just under 11,000 Kentuckians on those waiting lists. So if you think about people, and some of those have been signed up since they were little, because parents know how long it will take to get them. And if you need a residential option, you're pretty much limited to the supports for community living waiting list, which is the SCL. So yeah, those waivers, I really applaud that. And certainly the abuse and neglect issues are just scary, quite frankly. So we welcome focus on those.
I agree completely, and I think we can make a difference. But again, I think it's really determining where we need to focus and where we can make a difference, and it'll get into many different layers. Looking at poverty, looking at the Medicaid population, which spills over in. I think there needs to be, and you've heard me say this before, we need to get a stronger tie between economic development and where the Medicaid populations are within our Commonwealth, because I think there's some correlation there that we can have some major impacts in a lot of different areas. So that's another angle that we hope to look at as we move forward.
A lot of food for thought and a lot of great educational opportunities in your committee. Representative Heavrin, let me ask that same question of you. If you had to name, 2 issues of top priority for you, what would those be for your committee?
I think foster care is going to be one of them, foster care and adoptions. I think that's a really prevalent conversation right now, and I think we need to do better as a Commonwealth on those issues. There's a new member, Rebecca Raymer. She's filed a bill. I'm going to be helping her with it. That's a foster care toolkit for teachers. So that's a bill that you'll be coming through soon, probably the 2nd or 3rd week, depending on where it falls. But we've got a lot of teachers that don't know really what to do with foster care, and so what can we do to provide them resources? So the bill asks that KDE actually put some resources, a toolkit together for the foster care liaison. I did not know that each school district has a foster care liaison. And so, having them, dispersing that information to them, and then they'll be able to share that amongst the teachers in their district. And I think we've got to start meeting kids where they're at. And I think, mental health, I think that's probably more of Kim's area, but as she mentioned, or Chairman Moser's, I think that we're going to have a lot of gray areas and intersection, but we really got to have a conversation on mental health. And I think that really plays a big part into the children's homes and even the juvenile detention centers. I realize that that's judiciary, but that's juveniles too. And so how do we make that better for them? So I think, I think that's going to be a really big focus because these, these are our future. This is the future of Kentucky. And, we can't help the situation that we get born into, but we can help the situation. What's the outcome of that? And so how can we do better as a state, providing options for them? And we're all going to have philosophical ways that we achieve that, different philosophies, but, being respectful in that manner and having some really good conversations. I think another thing you probably will see is the benefits cliff, as Senator Neal mentioned. That's something, we had a great conversation this interim over that, and that's something I've been working with Speaker Pro Tem Mead on that, and Representative Dixon, who actually ran the task force. And so I think you'll see that coming out to this session, probably getting some more information from CHFS. As a chairwoman, I really want to prioritize making sure that we've got we have good data. I know people get so frustrated, like, why do you need so much data? But we really don't need to be making policy decisions based on what we think. We need to be making policy decisions on the data that we see. And so that's something else that'll be a really big priority.
Yeah, that's you'll be very busy during the short session, but those are all great topics for you to take on for sure. Thank you. Senator Meredith, I'm wondering if there's a couple pieces of legislation that you're thinking are likely to come, or maybe you've already seen filed, that are likely to come to your committee that would be priorities for you.
There's several pieces. Again, trying to keep this within this 30 session is going to be a little bit challenge, but I think we can do it. But for me personally, I'm going to try to address the longstanding issue, the access for care. You know that 1.7 million of our population is on Medicaid right now, but having Medicaid coverage is not commensurate with having access to care. And I get frustrated with these healthcare deserts that exist within our state, both rural and urban. I'm an unabashed rural advocate, but I think we can formulate programs to address both these shortages. And maybe I'm a little too pragmatic for my own good, but I don't think you have to have a whole lot of data to understand what's happening in these healthcare deserts. There's a direct correlation with recruiting professionals to address these issues and the percentage of Medicaid population you have to take care of. That's particularly most pronounced in these areas. And I'm always asked the very basic question is, why won't healthcare professionals choose to practice in these areas? And the answer is quite obvious, is why would you want to work in an environment where you know that you're going to be getting 25 to 30% less than your urban counterparts, principally urban counterparts? It just doesn't make economic sense, unless you have a mission to serve in those type of communities, and many people do, but they shouldn't be penalized for having that mission. So one of the things I'm going to try to do to address this is we're going to have hopefully pass a resolution directing the Department for Medicaid to develop a payment methodology based on the deprivation index, so that we can redistribute these funds and get them in the neediest areas, and hopefully this will enhance recruitment. When I hear about the shortages, and I've been in this business 40 years, the solutions I'm hearing are the same things I've heard over the last 40 years, and obviously haven't been effective, such as tuition repayment, things of that nature. That certainly is a help, but it's not addressing the fundamental issue. It's got to be, we have to allow these people to make a good standard of living, just like they would if they were in an urban setting. So I think this would help address that. In fact, I think these folks should be paid more, because that's where our most severe health problems are, and there's immediate savings to that. And you've heard me preach before that we never really take time to measure the cost of doing nothing, and it's quite substantial. And if we will take that on, have courage and conviction to address those things, I think that we can address a lot of these problems. Second thing, which I've always harped on since I've been in the Senate, and like Representative Moser, I actually came in 2016 when I was elected, is the administrative burden associated with the Medicaid program. Again, many of you heard me preach time and time again about 6 managed care organizations are too many to administer this program. And I can show you studies after study that substantiate that, but I think there's potentially as much as $500 million in savings administrative expense, direct expense, if you could reduce the number. So I'll have a bill again this time to reduce it to 3, and hope we're successful in that. I know many people heard the testimony this summer from a small provider in rural Kentucky, mental health services, that had an audit of her claims by 2 different MCOs. The first one came in, did the audit, and said, no issues whatsoever. Second one comes in and says, you owe us $25,000. And a year later, she still hasn't recovered that money because it's on appeal. That's devastating to a small provider, particularly in a rural community. So we have to address that. So I think this is fourth year I've filed this bill. I hope and pray to get some traction, because I don't think people understand and appreciate how desperate some of our smaller healthcare providers are in these communities and healthcare deserts, which make the situation worse for them. Certainly, one thing we need to do is pass the reorg bill for health and family services, which came out of our task force this summer. And what we learned very early on this task force is it's probably a 2 to 3 year proposition for us, because it's such a huge, huge cabinet. You know, it's the largest cabinet of state government, 7,000 employees. If you look at the Medicaid program, in addition to just the expense associated with that, it's about a $30 billion program that we're having to wrestle with. So there's things that are quite obvious to it that we need to address, one being Child Protective Services. One of the recommendations in this bill will be to move that function to Attorney General's office, because we have $1.4 billion in outstanding child support claims that are just kind of sitting there. We need to do a better job, but it's things of that nature that we need to have passed in this bill. So we'll try to do that very early on as well. Moving away from Medicaid a little bit, something I know that Chairwoman Moser and I both have an interest in, and that's PBM reform, prescription benefit managers. That it's a significant problem for healthcare providers, both urban and rural. On the Senate side, we're going to try to do it in two different ways. First, Representative Steve Riley's bill, who was passed out of the House last session, more comprehensive PBM reform. And we'll do that as one bill, but I'm going to carry another bill that's more consumer oriented, and it calls for 80% of the rebates to accrue to the consumer at point of sale. So this can help people, I think, immediately reduce their prescription costs. So that's something we're going to be working on, but that's the major areas that I'm going to try to focus on during this next session.
Great. I love the idea of getting some relief for consumers at the point of sale at the pharmacy for those medications. And Representative Moser, a couple of bills that you might be looking at in your committee this session.
Yeah, well, there's certainly no shortage of topics to focus on, as you're hearing. I mean, we all have various priorities and a lot of overlap. I'm happy to help my colleagues in any way move some of these pieces of legislation, certainly to continue addressing mental health and substance use disorders. We have, a continually exploding rate of overdose deaths now from fentanyl, and we've got just a huge problem. Now, I mean, we have spent years, the last several years, of really bolstering our infrastructure and making sure that we have more treatment beds, but there are still gaps in the system. And so I'll probably be addressing some of those. On the fentanyl side of things, we have this really is not a big bill, but fentanyl test strips are something that individuals can use to just ensure that their drugs are not adulterated with fentanyl, since that is causing so many deaths. Now, I mean, I don't want to give anyone false hope that this is making your illicit drugs suddenly safe. That's not it at all. But if we can change behavior and raise awareness, that's really more the point. So right now, fentanyl test strips are considered paraphernalia. We don't want individuals being arrested for trying to make sure that they're not going to die. So, it's this bit of our statute that really can be easily cleaned up. I also want to add to that an awareness campaign. And so I'm talking with the Attorney General's office. In fact, I'm on a roundtable up here in Northern Kentucky tomorrow to discuss the fentanyl issue. But they have an awareness campaign that they would like to work on. So does the cabinet. The DEA has one that we could easily also promote. So I think that there are real ways to educate the general public about the dangers of fentanyl. And certainly mental health is a huge part of substance use disorders. And so, just continuing our work, we have passed things like mental health parity, mental health first aid. We've done a lot of work to really address mental health. We still have a way to go. I saw that Marcy put a question in the chat about youth mental health crisis. We do have a youth mental health crisis at the moment. Things seem to be getting worse. I don't know, of course it's multifactorial as far as the causes go. I don't think COVID helped things. And so, we're probably going to be dealing with behavioral health issues and mental health issues in children for a while. We are seeing the behavioral health issues rise to a new level of acuity. And I think that's a real situation, especially in our juvenile justice system. So we're having conversations around the juvenile justice system and how do we increase safety for not just workers, but the children who are in detention, or how do we have conversations that really improve upstream thinking, as well as dealing with the here and now in detention? How do we prevent children from ending up in the juvenile justice system? So that's something that we're talking about as well. I always seem to focus on access to care. You talked a little bit about the community health workers, and that was really creating a statewide system of navigation to address the issue that, despite the fact that we have expanded Medicaid, we still have an issue with individuals still accessing the care. So what are the problems? And ensuring that community health workers can be embedded in primary care or dental offices or QHCs. We hopefully are going to address the issues that are keeping people from accessing care with that program. We are #1 in lung cancer in Kentucky. Last year, I passed a lung cancer screening bill that gets people into their screenings earlier, obviously catching the cancers when they are easier to treat. And so we'll continue our work. I have a bill that I will file on next Tuesday that improves coverage for biomarker testing to ensure that cancer patients get the right treatment the first time and don't have to go to the financial cost and the human cost of trial and error of toxic treatments. So look for that. Still working on Medigap and closing those coverage issues for seniors. And what else? Oh, I wanted to mention that when we were talking about maternal health, and I am also very interested in this space, we passed a bill that it started out freestanding. Representative Willner and I worked on Medicaid, expanding Medicaid for postpartum women for 12 months. We ended up adding that as an amendment to another bill, but we did get that through last year. So that was also good news. There are a lot of programs I could talk about, but I'll stop there.
You only have 26 days when you come back.
Mm-hmm.
So you're going to be very busy. I'm going to skip over to Representative Willner because I know that you have another commitment, and give you an opportunity to talk about what your top priorities would be, really focusing on families and children maybe in the next session.
Sure. First of all, I appreciate everything Representative Moser just said. So thank you for all of that, Kim. Closing those gaps in services are so important for so many different populations. And look forward to hearing those bills and working on those. One of my priority bills for a number of sessions, well, really since I was first elected, was the bill to ban conversion therapy. And this has felt like to me, it has felt like very low hanging fruit, right? Every medical organization, mental health organization, healthcare organization in the state and across the country has said that this is a discredited practice that hurts our kids. We're allowing people in Kentucky with licenses to practice in mental health specialty fields to provide this treatment. I'm using that term very loosely. And we know that when vulnerable kids, because we're talking about LGBTQ kids who are very vulnerable to a lot of issues, including poverty, including mental health struggles, including various kinds of trauma. They're more likely to be involved in sexual abuse and sexual assault than kids not in that population. And this would send such a strong message from our legislature that holding a license in Kentucky to practice mental health means something. And Sheila, you and I are both licensed psychologists. We know how hard we work to get those licenses, and those really ought to mean something. And so we've had just tremendous, actually bipartisan support in both chambers on this issue. Actually, both sponsors of the bill on the Senate side last year were Republicans. We've had very strong bipartisan support in both chambers. We've had an interim hearing, and I would love for 2023 to be the session where we get this done and send this really important message that our mental health providers, to have a license in Kentucky, you can't be engaging in practices that hurt our kids.
Excellent. And I'm glad to see it come back. Representative Heavrin, let me shift to you real quickly, because I think you also have a commitment to get off early. And I wanted to come back to the benefits cliff and to ask you about the basic health plan, because I think you and Representative Dixon had a bill this last session. Before that, we had HJR 57 to look at the development of a basic health plan. And with the unwinding coming now because of the end of the emergency period, I wonder if there's some interest from your committee, possibly from Representative Moser's committee, to go back and look at that issue as part of what we ought to be doing, because we know that a number of people are going to lose their Medicaid coverage. I think the estimate has been 80,000 because people could not be taken off Medicaid during this emergency period. So I wonder if you have some thoughts about that as well.
Sheila, honestly, I'm still learning about it. I think that's more probably in Representative Moser's wheelhouse, and probably in making an insurance as well. I know a lot of medical insurance conversations go through there. I'm not afraid to say I don't know a lot about some of these issues, and so that's one that I'm still learning about myself. So I look forward to working with Chairman Moser on that and hearing from people. And I think that's the best way to learn, especially as a representative. And I have no doubt will be helpful to sharing information about that as well. It's a big conversation, and so I do expect it to come. I just don't know where it's going to land. So I do look forward to working on that with all of my colleagues here on this call.
Yeah, I appreciate that very much. And I think, it's something that the cabinet needs to get going on, I guess is my sense of it. I think the other thing is, will you be revisiting some of the benefits cliff discussion that you all have had in the past? I know you've worked on the calculator and so forth, but I would guess that there's more work to be done. People losing their Medicaid.
Yes, there's a lot of conversation about that, and I think we'll continue. I've been working with the state chamber on the calculator for the benefits cliff. Ours is not very good. And so we're going to be working on that and having further conversations to see what we can do to be helpful. I do greatly appreciate you. Still make money. And so I've got to roll because I'm working for a client today. But thank you all so much. Thank you all for being actively engaged. And I look forward to working with each of you all in the future on these issues.
Thank you. And we thank both Representative Heavrin and Representative Willner, and we'll follow up. There probably are some questions that would come to you, so we'll follow up with you. Thank you so much for being with us. Senator Neal, let me come to you and ask about pieces of legislation that you're thinking of in the kind of family and children's space. You've worked, on these committees in the past. You've worked in the judiciary, which sometimes is overlapping with some of these issues as well, and wonder what your sense of priority is in some of those areas.
Well, if I may, I'd like to step back on the benefits cliffs discussion.
Oh, great.
As well, because I think that's an area that we really need to give some attention to. And there are all kinds of mechanisms, all kinds of strategies to deal with this. And I'm hopeful that we will have some action taken in this particular legislative session, of such as, there's discussion about increasing the income eligibility threshold for benefits as part of the pieces that would ameliorate this situation. Our gradual phase in of benefits. This will allow recipients to keep some benefits as they earn more. Tax credits for low income individuals, implementing a refundable tax credit depending upon the eligibility with respect to that. Expanding Medicaid. There are a lot of things that can be done to address that. And I think it's one of these kinds of things that's is counterproductive for us to encourage people to actually seek higher income brackets, at the same time penalize them because they reach a certain income level. So I'm hopeful that we will have an opportunity to address that on somewhat of a lighter matter, because I'm dealing with some heavyweights on this panel right here. I mean, look here. These are people who live and have professionally functioned in these areas. And I have to give deference to them and listen very carefully to what they're saying. So I'm very excited about some of the legislation that I'm hearing on the House and the Senate side with respect to that. But I do want to bring up just one little thing that I'm hopeful that will get some traction this session, and that's my music therapy bill. And I raise that because a lot of folks do not understand the power and the tool and the efficacy in terms of what can happen in that area when people who are trained adequately, professionally, provide that type of service to people. Music is a very powerful tool for health, particularly mental health situations. We have in Kentucky something similar to what I'm proposing in the art area. They have a bill right now. In fact, we have law right now that deals with that. But basically, this music therapy bill will actually give some real standards, establish standards, some oversight, bring people to the table to get into questions of best practices, educating the public generally, et cetera, and specifically depending on the subject matter. And most importantly, in that context, provide a tool that I think is going to be helpful for everyone. I think this should be, and hopefully will be, a bipartisan measure. I think it is something that is pretty simple to understand, and that with respect to that. But as it relates to families and children, if you look at the broader context, just think about it. We are at the tail end of, and I think we have somebody used a term the other day, first time I'd heard it, endemic. We're in situations now where we're coming out of this pandemic mode, and it's had a tremendous impact, and it's created and exacerbated disparities in healthcare delivery and services, et cetera. I think we're gonna have to take another look at that and the impact of the pandemic with respect to this. And I think some of the things that have been talked about today actually will have the capacity to address these things. But we have to look at this like increasing access to primary care. We have to give access with respect to people, the regular access to preventive care, for instance. We have to, in my opinion, and I think you've heard this a lot, people need to educate it to what hurts and what helps them in terms of their lifestyle and what they eat and et cetera. And that means there has to be access in these various communities. Senator Meredith talks about the desert on that side. There are deserts, food deserts, et cetera, in some of our communities. We have to address that. The broader access of the use of telehealth, I think is going to be very important. And that gets into a question of access to in terms of, technological pieces. And I think that data-driven thing can't be overlooked. I think we do have to look at that data, but I do like the comment that was made by Senator Meredith again, is that you don't have to have a whole lot of data to understand that there's some things right before your eyes that common sense tells you needs to be addressed. So I think if we don't know, we need to go into those areas and find out with respect to that. So there's a number of things I think that can be addressed in one way or the other, and some of the stuff that's been offered here today. And I think I'm hopeful, although we are in a session where I think everyone pretty much agrees we don't want to do too much. We probably want to turn our sights back to what we've done historically, at least when we first started the short session. But I think we do need to seize the opportunity and not wait cycles when we know there are obvious things that need to be addressed. So I think we have the opportunity, and I'm hopeful that we'll take it.
Thank you. And thank you for letting us know about your music therapy licensure bill as well. There's been a number of positive comments in the chat about the power of music therapy.
I'm just glad we got Senator Carroll and Senator Meredith on this. So I've made my pitch. I've made my pitch to my colleagues as well. So hopefully we can get that moving. Thank you.
Did you want to make a comment, Senator Carroll?
Well, I was just going to say that Senator Neal may have to sing to us to gain our support on that bill.
Hey, I tell you what, I've been known to sing now and then if it's something important.
I was going to say, I think he's somebody who can take up that challenge, as I understand it. So let me circle back for a minute on the basic health plan and ask, let me go to Representative Moser, who probably knows as much about this or more about this than most people, because you did the original joint resolution. Do you see this as something that needs to be revisited at this point in time, with the unwinding starting in March, actually, and the end of the emergency period?
Yeah, I definitely think that it's something that if it had been in place already, it could be very helpful with the unwinding. I know that we are going to probably see a fair amount of panic, but hopefully it'll be a slow kind of unwind, and individuals who are right on the cusp of eligibility will be able to continue with their public assistance while we straighten things out for them. On the I guess on the benefit cliff and on the public or on the basic health plan. So House Joint Resolution 57 was a resolution that I sponsored to take a look at the benefit cliff and whether or not bridge insurance was something that could be implemented. And so we put together a work group and really had a good conversation about this for probably 5 or 6 months, as I recall. And what came out of that was, and we talked a lot about the benefit cliff, and not only the problems that dropping off or hitting that benefit cliff, not only the problems that it causes for the beneficiaries, but also workforce participation, the staffing challenges that it presents employers. And so part of what we discussed we did bring in some modeling programs. We talked with the Georgia Center for Opportunity, who has a great benefit cliff calculator. I think KY Stats is who the cabinet uses right now for their benefit calculator. And it doesn't do exactly what I anticipated. But out of that conversation, the cabinet went back to the idea of a basic health plan. And to me, that's really nothing more than expanding Medicaid. It's not being all that innovative. It might help in the short term, but I think we have a real opportunity to work with our employers and get creative, much like we did with House Bill 400 about the child care pilot. If we can take a look at how to engage our business owners, our employers, and implement a benefit cliff calculator in a system where maybe the state subsidizes half of the healthcare premium or the insurance premium for the individual, and the employer the other half, and we implement a benefit cliff calculator, we can really, on an individual basis, look at where folks are about to fall off and stair step them off of the benefits rather than have them just hit this cliff and not be able to advance in their jobs and there again, presenting challenges for employers. We already have a workforce participation issue, and it's again, there are many reasons for that, but I do believe that the benefit cliff is a real reason. So if we can get creative and really take a look at it, I think now's the time. The benefit cliff task force did have some recommendations, and I agree with Senator Neal on some of the provisions that he talked about. But we've tried expanding Medicaid. I think we need to get a little bit more targeted with our taxpayer dollars in terms of how we provide these benefits. And in the end, nobody really wants to be dependent and stuck in that cycle of dependency. So how do we really enable individuals to stair step off of some of these public assistance benefits? I mean, that's the whole point of a benefit calculator.
Literally don't want people to take this suicidal drop off of the cliff, and that's where the calculator comes in and so forth. For those who are on this that may not be as familiar with what we're talking about in terms of unwinding and so forth, during the pandemic emergency period, no one could be removed from the Medicaid rolls, even if their income had gone up beyond the eligibility and so forth. So what's starting to happen now is the recertification of people that are on Medicaid. So the number one thing for everybody on the Zoom this afternoon to know is that if you know anybody who is currently a Medicaid member, be sure that they have their accurate address in the system, because that's going to be the very first step. And there are a number of people, and I think the department is working very hard to be able to get the information to validate that people can stay on without having them do anything. So there are the vast majority of people that we think that they can get the data to affirm that their income levels still meet the criteria and so forth. But there is this group of, I think the number is 80,000 that are going to have to go through a recertification process. And if they can't reach them because they don't have their correct address, that's the number one problem. So the thing you can do right now to get people ready, and I think this would be true for any of the providers. I know the MCOs are already engaged because it's to their benefit to keep people with their accurate address and so forth. So that's really the first step in this process. Senator Carroll, Senator Meredith, do you have anything that you would like to add on the discussion about the benefits cliff or the basic health plan?
Well, I personally think we're all on the same page with this one. And, you know, opportunity always arises out of adversity. And certainly coming out of this pandemic, we've identified numerous opportunities. But I think particularly with the benefit cliff, with the shortage of workers in Kentucky, there's real potential for a symbiotic relationship between the business community, between state government and our citizens like never before. And I think that opportunity is there if we will just think outside the box. It seems that we've always focused too much it's on either or. And I think this is going to be a unique opportunity where Kentucky can lead the nation in coming up with innovative ways to do this. And I'm quite optimistic that we can come to it. I just hope we can give it some sense of urgency. That always seems to be a struggle for us. But again, so many bills that we have to consider, it's a challenge. And I think even this 30-day session, we really need to have some discussion about what the legislative priorities are, because I anticipate we're going to have numerous bills filed again. But it'd be nice to be able to take care of everything, but we know in reality that it can't. And we're not that far away from the next budget cycle. So we're going to be hearing from people about that. But same token with that is we need to really establish some priority as to what we want to address first. I think we have a tendency sometimes just to throw the jello up against the wall and hope something sticks. And I really think we need to identify these priorities and try to knock them off one by one. You know, such as lung cancer, that's been there for forever. I think we're buoyed by the success of the colon cancer screening, what a successful program that has been. And if we'll focus on more initiatives like that, then that helps us make decisions for funding later on down the road. So again, some great, tremendous opportunities for success in the future.
Yeah, absolutely. Emily, I wonder if there are some questions in the chat that people have posed that you might throw out there to our panelists.
Yes, we've had a few questions. Some of them I think we've touched on, but this most recent one from Margaret Pennington, again, going back to the pandemic and many of the flexibilities that were put in place during the pandemic to make it easier for people to keep their coverage and to access services for mental health and substance use disorders, which we know that need has not gone away, it's only grown. So with those modifications that were put in place, and some of those probably, you know, having to go back to normal, some of the flexibilities we know are going to no longer be available to Kentucky, but others may. And is there any conversation right now with the legislature about what that impact could look like and losing some of those flexibilities and any opportunities to make some of those flexibilities permanent? Looking for ways to just continue to remove barriers to those services.
Well, I can jump in. First and just talk about the prior authorization, for example, for behavioral health services and substance use disorders. Those have that, you know, it was relaxed during actually, I think some of it was relaxed through a waiver prior to the pandemic, and they were relaxed even further in several ways during the pandemic. And so I think it's an opportunity for us right now to take a look at how that really worked out for the cabinet. Did it cost the state a lot? Did it, you know, what was the return on investment? And because I am working on a bill to provide or implement a waiver for lifting prior authorization for providers who have their prior authorizations approved at 90% of the time or better, it would provide a 6-month waiver, and this would be for all services. And so, you know, it's looking at lifting a barrier, and enable patients to get care when their physician or APRN orders it, and also lift a bureaucratic kind of nightmare for healthcare systems. So which of course gets passed on to patients. So, you know, it's kind of a common sense solution. We saw that it was relaxed during COVID, and we just want to take a look at the data and see what how those outcomes really changed and what it costs the state before we move ahead. But I do think that was something that was very positive in ensuring that, folks got the behavioral health care that they needed.
Yeah, certainly the lifting of the prior authorizations, and I think it's only been restored in Kentucky, Representative Moser, for the residential SUD services, but all of the others in behavioral health are still in place. And that was a decision made locally here by our Kentucky Medicaid. And I will tell you that providers have been very happy about that. I think our data on things like targeted case management for people with severe mental illness and so forth shows that that's an effective service and not one that one should have to go through a PA process for over and over again. So I guess the other one that occurs to me is some of the flexibilities in telehealth that were instituted at the CMS level so that you could use audio only, for instance. And my guess is that that's going to go away, which I think a number of providers and I think consumers, patients would say would be a real loss here in Kentucky, since
well, it should go away in Kentucky because we added that to House Bill 140. So we have audio only, which is allowed in Kentucky.
Great,
yeah,
great, because that's been a concern. As you know, we have limited broadband for one thing, and so sometimes, and the need for crisis services and so forth. So anyone else on the panel want to weigh in on some of these flexibilities or changes?
Well, I would, if I can offer this, there are opportunities to strengthen families generally, and I think that's very important. We need to look at investments, I believe, in childcare and other public services. I think that's very important. And opportunities are out there. We can deal with that. Providing affordable, high quality childcare is extremely important. And it's a deterrent. I shouldn't say, well, deterrent may be the word, for those who would want to actually engage in the job market more aggressively, but they don't have that type of support in order to do that. And providing services that help families access healthy food, et cetera. And I could go on with the things that are deficient in certain communities, but we ought to look at that. It doesn't happen everywhere. It happens in certain areas, and we ought to be very intentional about that. I think we have opportunities to deal with that. Something even as simply as offering flexible work arrangements and paid family leave, for instance, I think is very important as well. So, we can talk way up in the sky about things and we can get real technical about various kinds of things, but some things just boil down to the fact that government and others, nonprofits and others, got to be very intentional about how do we alleviate these disparities, deficiencies, and we can do it if we're intentional about it. So there's an opportunity every day to do this. This discussion is an opportunity to do this. We should continue it regardless of how you view it, and we should make it happen. I've always been a fan of, you want something to happen, you make it happen.
Make it happen, absolutely. And I'm sorry that Representative Heavrin had to leave before I could ask her about, has spent probably the last 2 sessions with a work group looking at paid family leave, and is trying to put together a good comprehensive program around that, because it's something that we don't have in Kentucky. And certainly both Senator Carroll and Representative Heavrin have talked about the childcare issues. I know we have funding right now, but that funding is going to go away, which makes everybody really, really nervous about that opportunity. I think the other thing, Senator Neal, that we talk about in terms of access, and you talked about this earlier, is transportation. And that's where telehealth has come in so much. But we have done some work with the cabinet on non-emergency transportation for our Medicaid recipients, and there are some changes being made. One of the things on the ground is that if somebody has even a beat up jalopy that hasn't run in years sitting in their yard or in their garage, they sometimes don't qualify for Medicaid transportation because they're seen as having an automobile, and they are changing some of those things now. That's the kind of on the ground feedback that we've gotten and taken that to the cabinet. So trying to work on that issue as well. Emily, we may have time for one or two more questions if you have some from the audience.
There was a question a little earlier about the 2021 Minority Health Status Report. I'm not sure if everyone's aware of that yet. It was released just maybe a couple of months ago, and Marcy Timmerman put a link in the chat. But just, I think, generally a question about how we look at health disparities, how we identify health disparities in Kentucky, and really target our interventions to reduce those disparities, and what we can do with this data.
Can I step into that just for a moment?
Yes.
I have filed in successive sessions a bill to do just that, to deal with that question, to look at what we deal with in terms of policy, to make sure that even though we're approaching things, when somebody puts a bill in, that doesn't mean everybody's tuned in. You almost follow somebody else's lead. People do various kinds of investigations themselves, and they emphasize other things. But what this bill would do, if it's flagged, I'll just use that term, then the sponsor of the bill then would have to go through a process just like we do, or similar to what we do when we're dealing with fiscal matters. And they would have to come back, and this becomes a discussion and the justification of certain action. It doesn't preclude that person from proceeding, but it becomes more of a point where we can engage further and get more information so that we can make informed decisions, particularly in this area. It hasn't gotten a lot of traction, and I think part of the reason is because it's going to cost some money for the health department. That branch is involved in this, would be involved in this, is going to have to beef up its staff a little bit to address this particular area. So I don't know whether or not what's going to happen. I'm going to keep it on the plate, and I'm going to keep reaching out to Senators Meredith and Carroll and others. And I hope Senator Carroll doesn't make me do things I don't like to do and try to get something through. But I think it's worth a discussion, if nothing else. Hopefully this cycle, a discussion on it is all I'm really looking for this time. And if we can do that, maybe we can do something effective in that area, because certainly there's a need. There's no question about that.
Emily, who was that report? How was that report released? Because I know it was coming, but I'm not sure.
The Department for Public Health, the Kentucky Department for Public Health, has the Office for Health Equity that has published this report. I think the report before 2021 was released in 2017, so this is many years coming, and of course, kind of mid-pandemic, and so there's really a lot there to look at and to really kind of focus some new energy around in terms of ways that we can reduce disparities in Kentucky. I think somebody may have just posted it again, but that's a report definitely worth looking at, and perhaps asking the Department for Public Health to come and give a presentation. I will say that in looking at Kalisa's follow-up question, I think more specifically, she's interested in how nonprofits can help to eliminate disparities and bridge the gap between government and the population who need some of these interventions and additional services, access to care without barriers and so on. So if there are any thoughts on that, of course, House Bill 525, the reimbursement for community health workers, comes to mind, Representative Moser, but if folks have other ideas about how we can, kind of engage our nonprofits in this work, I think that's what we're looking for.
Well, certainly. Go ahead.
Well, thank you. I was just going to say, it's always helpful for us to hear directly from our folks who are working on the ground. And you are the ones who see how some of the policies that we set really work, and whether or not it creates more of a problem. It's important for us to know this. It's also good to know when something works, but there are always little tweaks that we can make, or gaps in the system that we need to know about. So I would just say it's important for you to reach out to us. And now that you know who we are and what we look like, you can find us easily on our LRC web pages, and just reach out to us. We certainly enjoy hearing from our constituents, but also the folks who are working with patients around us, around the state.
And I think that's a good point to end on. Thank you for that, Representative Moser. You all have been most gracious in working with Kentucky Voices for Health and with all of our partner organizations. I will say, as someone who runs nonprofits, and I look at Senator Carroll, who also runs a nonprofit agency that is doing really some of the work of the state, if you will, and providing services and so forth, that I have found you all to be very open to input, and really encourage everyone on the who's listening to reach out to these legislators as chair people and the minority floor leader, but also to your own legislators, and use the 1-800-372-7181. We have rallies and have people chant that number. Reach out and try to come to Frankfurt and meet face to face with your legislators. It's much more open than it has been the last 2 years with the pandemic and so forth. But if the democracy is going to work, it really is a two-way street. And so we so appreciate Senator Carroll, Senator Meredith, Senator Neal, Representative Moser, and of course, Representatives Willner and Heavrin for being with us and sharing your thoughts and being so open to questions and so forth. We wish you well in the remaining 26 days of the session, and I'm sure you will hear from us again. And we thank you so much for your sharing your valuable time with us. And thanks to everyone who's been on. We had well over, I think we had 125 people at one time.
Yes, we did. This has been a fantastic forum. Thank you so much, everyone, and especially to our legislators for joining us today, and for Sheila, your excellent moderating. We will be following up tomorrow, as I mentioned, with the recording and some other resources for your advocacy. So thank you again. We look forward to working with you all during the rest of the session.
Thank you. Thank you, Sheila.
Yeah, thank you very much. Sure appreciate it.
Thank you.
Bye-bye.